Hello everyone, my name is Nadia Jones and I am a nursing student at Indiana State University's LPN to BSN program. This health education program is for Nursing 444 Community Health. Food allergies. Before we get started, please take a moment to pause this video and access the pre-test link featured in the video description below. Learning objectives. By the end of this presentation, all participants will be able to define food allergies, explain how consumers are protected from accidental exposures to allergens at the grocery store, identify the population at risk for food allergies, recognize the signs and symptoms of food allergies, identify leadership ways to prepare for an emergency, and explain how to administer an epinephrine auto-injector. After program completion, all participants should be able to pass the post-test. What are food allergies? Food allergies are defined as a specific and repeatable immune response after exposure via ingestion, topical, or inhalation to certain proteins in foods. In normal circumstances, the immune system works to protect the body from invaders, such as germs. In the case of food allergies, the immune system mistakenly recognizes the allergen in question as a dangerous invader. As a result, the immune response for food allergies may be mild, but also has the potential to be severe and/or life-threatening. Since there is no cure for food allergies, most patient education revolves around the avoidance of known allergens. Current legislation. There are laws in place that protect consumers from accidental exposure to allergens when purchasing food at the grocery store. In 2004, the U.S. government passed the Food Allergen Labeling and Consumer Protection Act of 2004, which identified 8 major food allergens responsible for 90% of food allergies. These 8 major food allergens are tree nuts, eggs, shellfish, meat, peanuts, fish, wheat, and soybean. In 2021, the Food Allergy Safety Treatment Education and Research Act declared sesame as the 9th major food allergen. Under the Food Allergen Labeling and Consumer Protection Act of 2004, packaged foods that contain one of the major allergens are supposed to be specifically labeled with the name of the allergen. Meats, poultry, and eggs are not required to be labeled. The purpose for this legislation is to assist consumers with the identification and avoidance of known allergens. The current good manufacturing practice, hazard analysis, and risk-based prevention controls for human food rule requires manufacturers and food packagers to prevent food allergen exposure via cross-contamination. Who is at risk for food allergies? According to Costa et al., the prevalence of food allergies has grown exponentially over the past few decades. An estimated 5% of all people suffer from food allergies. According to the CDC, 15 million Americans have food allergies, and it's considered a serious medical condition. Similarly, the CDC reports that 8% of children require allergy action plans at school for food hypersensitivities, which equates to about 2 children out of 26. Food allergies can occur at any age. Children who are diagnosed with food allergies usually need an allergy action plan and medication stored at school. According to a study by Herschel et al., children who are prescribed more than 3 antibiotics are more likely than those with fewer or no antibiotic prescriptions to develop a milk allergy. What are the symptoms of food allergies? Symptoms of an allergic reaction vary from mild to severe symptoms, which may include any of the following: digestive upset, vomiting, diarrhea, abdominal cramps, flushed skin or rash, hives, tingling or itchy sensation in the mouth, face, tongue, or lip swelling, lightheadedness, dizziness, cough, wheeze, difficulty breathing, swelling of the throat or vocal cords, and/or loss of consciousness. When the reaction is severe and life-threatening, it is called anaphylaxis. In fact, anaphylaxis may start as mild symptoms before progressing to respiratory distress. Anaphylaxis is a life-threatening allergic reaction that is not exclusive to allergens in food. Luckily, anaphylaxis related to food allergies is not a common cause of death. However, it still constitutes an emergency and a public health concern. According to Tano et al., anaphylaxis costs $1.2 billion per year in the United States. Many cases of anaphylaxis occurs in patients with diagnosed food allergies and/or a history of asthma. Although any allergen can cause anaphylaxis, the most common foods are peanuts, tree nuts, milk, and seafood. According to Posel et al., the mortality rate for anaphylaxis averages slightly more than 1 death per 1 million, thanks to the accessibility of adrenaline injectors. Symptoms of anaphylaxis may include the airway, skin, stomach, heart, and/or brain. How can we use leadership to prevent an anaphylactic reaction? The first step to addressing anaphylaxis is recognition. Although food allergy public awareness has already been initiated, it does not address the problem from a global perspective. Mass accessibility to epinephrine pens, coupled with public awareness about how to recognize anaphylaxis, will improve current mortality outcomes. In a school setting, nurse leaders can utilize a team approach based on doctor's orders for anaphylactic emergency preparedness. Within this team approach, families and doctors can create a care plan for the child with food allergies. By training the staff on allergic reaction recognition and proper administration of emergency medication, nurse leaders can manage food allergies and help prevent anaphylaxis. Types of adrenaline or epinephrine injectors include EpiPen, AviQ, and generic epinephrine pens. If someone is experiencing anaphylaxis, it's important to know how to administer an epinephrine autoinjector. This example is specific for the EpiPen. To prepare, you will remove the autoinjector from the clear carrier tube. You will hold the autoinjector in your fist with the orange tip pointing downward. With your other hand, you will remove the blue safety release by pulling straight up without bending or twisting it. You may need to hold the person's leg firmly in place while you administer the injection. Epinephrine can be administered through clothing if needed. Place the orange tip against the middle of the outer thigh at the right angle to the thigh. Then swing and push the autoinjector firmly until it clicks. The click signals that the injection has started. Hold firmly in place for 3 seconds, counting slowly. 1, 2, 3. Remove the autoinjector from the thigh. The orange tip will extend to cover the needle. Please keep in mind you will not see the needle at the beginning, during, or end of this process. There is a little clear box in the center of the epinephrine pen that will help you distinguish if the medication was administered correctly. Then record the time of the injection and call 911. Epinephrine can wear off, so it is important for patients to seek medical evaluation immediately. If you have any questions or would like to look into this topic further, please check the references below. Thank you, and please take a moment to once again pause this video and access the post-test and brochure in the description below.